Give it a second to turn on. There we go. So welcome everyone to BayCare Presents. This month, we are going to be speaking about the importance of routine well child checks. Just as it's important that we take care of our own well-being and make sure we're getting our annual preventative visits, it's also important as your child is growing that you're taking them to those visits, that they're reaching those certain milestones, and that you're kind of paying attention to those needs. And today we have with us Dr. Harris. She is a caring and dedicated physician here in the Tampa Bay area. She attended the University of South Florida and is part of our BayCare medical group as a board certified in pediatrics. She's very sensitive to the uniqueness of each patient's situations. We are all unique, whether we're a child or an adult, and we need to make sure that when we're speaking with our physician, we're asking our question, they're adapting their consultations, their treatment plans to meet our needs and to be able to have that conversation and that relationship with them. And that's going to help make sure that everyone is happy at the end. It's always that relationship and your unique needs that are getting met. So I am going to let her share her passion with you now as she shares with us the importance of routine well child checks. Thank you, Dr. Harris. It's all yours.
Thank you very much. And again, thanks everyone for taking time out of your day to come. We will open it up to questions at the end. So I'm just going to take a few minutes to talk about why it's important for your kids to come in for their routine well visits. We get a lot of families that come in sometimes only for sick visits, and we'll notice that we haven't seen them for several years, just only for sick visits. So just want to hit on some reasons why it is important that you bring your kids in for regular well visits. So there's a lot of things that we do at well visits that we just don't address at sick visits. So more at our well visits, we're doing a lot of preventative care. So at each age range, the AAP has recommended guidelines as far as preventative care. So things that we're looking for. We're doing immunizations, particularly in the baby age range. So especially from newborn up to 2, those kids are getting immunizations at almost every well visit. So if they're not coming in for the regular well visits, they're typically falling behind on their immunizations. And then at each age range, there's specific, anticipatory guidance things that we're going to talk about, again, specific for each age group. And then a big part of your kids coming in for their well visits is that we're just building trust. So as they get older, if they've been coming in to see us each year, it makes it a lot easier as we get towards those later teen years when we're having more confidential conversations, that we have that relationship and they have that trust. So it just kind of helps when they come in when they're older. So I'm going to kind of go through each age range, and I broke it up into like 5 different of the kind of common ages where we see kids and talk about the important reasons in those age groups, why they really need to make sure that they're coming in. So in that newborn period, that's going to be right when moms, leave the hospital. We like to see babies within a few days of hospital discharge. At that point, we're screening for jaundice. We're looking for feeding problems. This is a common age where moms might be having some breastfeeding difficulties. We're screening for postpartum depression and making sure babies are having safe sleep practices. In infancy, that's going to be more in that first year of life, but kind of out of the 1 month period. So more 1 month to 12 months, really looking at their growth and their development, looking for any kind of developmental delay. And I'm going to hit on each of these areas a little bit more. In the toddler period, we're going to do autism screenings. We're checking for anemia. We're doing vision screenings, really looking at a lot of behavioral developmental concerns, problems with sleep. Young childhood, I would say, is more your like 4 to 10 age group. And there we're going to be looking again at growth and development. We're going to talk to them about nutrition, exercise, screen time. We do vision and hearing checks. And then in adolescence, there's a ton of issues that we talk about, a lot of mental health issues, anxiety, depression, substance use, sexual health, menstrual concerns, anemia, eating disorders. And again, I'm going to go into each of these a little bit more in detail in the next slides, but lots of issues to discuss at each of these appointments. So like I said earlier, one of the main things that we do at well visits is immunizations. I put out the whole normal childhood immunization list here, and it does seem like a lot. And you can see from birth to about 18 months, they do get immunizations at almost every well visit. So if they're missing appointments in that age range, they're oftentimes falling behind on their immunizations. It does tend to space out, as you can see, like between 4 and 11, we're really only recommending a flu shot and COVID shot annually. So a lot of times this is an age group where we will see kids kind of fall off, where they just don't make it in each year. As far as immunizations, I just want to spend a minute talking about it. I would say since the COVID era, we are seeing families have a lot more hesitancy with vaccines. For whatever reason. Immunizations have been very well studied. There have been multiple randomized controlled trials. We know that they do not cause autism. But with that increasing prevalence of families becoming hesitant about vaccines, we are seeing resurgence of some of these illnesses. For example, so far in 2024, there have already been 219 cases of measles this year in the United States. Last year, I looked, CDC reported 59 cases. So, with more families refusing these vaccines, unfortunately, I do think we're going to start seeing a resurgence of some of these diseases that previously were felt to be eradicated. So I feel like well visits are a really important time to talk to those families that do have vaccine concerns. I'm not trying to, blow them off or dismiss their concerns. I know there's a lot of misinformation out there. And so this is a really good time to really address with families, what is your concern? Let's talk about it. If they have, something that they read, I encourage them to bring it in and show it to me, and I'm happy to discuss it with them. So I do think immunizations are an important component of our well care visits. So back to the newborn visit. So when babies leave the hospital with mom, we like to see them within a couple of days of discharge for a few reasons. Most babies will lose weight in the first few days of life, and that is completely normal. We don't like them, however, to lose more than 10% of their birth weight. So when we see them, we're kind of checking their weight, we're checking their feeding. This is a common time where moms are really having transitions when they're breastfeeding. It's when their milk comes in, or maybe it doesn't. And so we're making sure babies are gaining appropriate weight. We can hook them up with a lactation consultant if they need it. We're assessing for jaundice, which tends to peak around day 4 or 5. So we're really monitoring babies' colors. We even have a jaundice billimeter now in the office where we can just use a cutaneous monitor, which was nice and can kind of save us a heel poke and having to stick them to check the blood level. So we're checking for jaundice. This is a common age where we might hear a heart murmur that wasn't heard in the nursery. Again, we're screening moms for postpartum depression, which is fairly common. And so, we're talking to moms, how are you feeling? How are you doing? It's not just about, the baby. We want to make sure if mom is having concerns for postpartum depression that we get her back to her OB and get her some care for that. We're going to talk about safe sleep practices. We know that babies have a much lower risk of sudden infant death when they sleep on their back on a firm surface. So definitely reinforcing that with all of our newborn parents. Then we're going to educate them on fever, signs of illness in their babies, kind of things to look out for and what is normal and what's not normal. So really important visit. We oftentimes will book a 30-minute appointment for this newborn, visit, especially if it's a first-time parent, just to make sure we get all their questions answered. It's definitely like an exciting but also scary time for a lot of new parents. So. After the newborn period, then I'm going to go through what I would consider like from that 1 month to 12-month period. So babies are going to come in typically at 1 month, 2 months, 4 months, 6 months, 9 months, and 12 months. So all those visits, we're really checking their growth and development. We're making sure that they're kind of maintaining on their growth curve. We're screening for any kind of developmental delays. So if kids aren't meeting the milestones that they're supposed to be meeting, then we want to make sure that we're getting them hooked up with any kind of therapy that they might need. On their exam in this period, we're screening for any kind of abdominal masses. We're looking for do they have swollen lymph nodes or any signs of leukemia? Do they have strabismus or eye malalignment? So these are all things we're going to be paying close attention to during this age group. As far as then the anticipatory guidance in this age group, we're still talking about safe sleep. We're going to talk about teething. We're going to talk about feedings. We want to make sure parents know, that the earlier, for example, that they start with solids in that 4 to 6 month time period, the less likely babies are to have food allergies. We're going to talk about choking, drowning prevention, making sure their house is childproof once their baby starts crawling. So there's a lot of anticipatory guidance that we do in that first year of life, in addition to vaccines when kids come in that infancy sort of period. Next, we're going to hit on the toddler age range. I would consider this sort of that 1 to 3 age group. This is a really common age where we see those preschool behavior problems like temper tantrums, biting, hitting. Again, at every well visit, we're going to look at their growth and their development, but particularly in this age group, we're looking at developmental and behavioral things. So at our 18-month and our 24-month well visits, all kids get an autism screening questionnaire as well as an ages and stages questionnaire that goes through the 5 areas of development. So we're really screening pretty closely for any problems related to developmental delay or any autism concerns. We are very fortunate at BayCare that we do have a developmental pediatrician that we work with, Dr. Hewlett. And so if there is any concerns in that regards, we can get them hooked up with him, which has been a great resource we've had in the past year. We start doing a spot vision screener at 18 months, and we're also doing, hearing screens in this age range as well. Toddlers is a common time where kids are very, very picky eaters. We see a lot of kids that kind of survive on milk and snacks. And so anemia is pretty common in this age group. So I see a lot of kids that we catch with anemia in that 1 and 2 year age range because we check a hemoglobin at all those visits. So if they are anemic, we certainly try and work with them on dietary changes, but also get them started on an iron supplement. So that's a common thing that we check for in toddlerhood. And then again, discussing lots of behavioral concerns, timeout, temper tantrums, problems with sleep, preschool transition, potty training. So these are all kind of issues that are great to discuss at a well visit in the toddler period. Young childhood, I would put this in around the 4 to 9 age range. This is probably the most common age group where I don't see kids other than sick visits for a period of time. They typically are required to have their kindergarten vaccines, which we give at 4. And then if they stay at the same school for K through 5, the schools don't require any kind of renewed paperwork. They're not typically playing sports yet. So a lot of these families will kind of not come in for several years in this age range. This is probably the most common age range where when they come in at a sick, I'll say, hey, we really got to get them caught up for their well visit. So again, we are looking at their growth curve, looking at their growth and development, and some problems that we might see just in this age group related to their growth would be like celiac disease, thyroid problems. So if we notice that all of a sudden a kid's weight or height has just dropped off, those are things we might screen for. We're looking for diabetes. We're looking for growth hormone deficiency. Again, if their height sort of plateaus or they stop growing in a normal trajectory, that would be something we might think about. And on the other end, some kids can have precocious puberty where they go through puberty, abnormally too early. And so that's something else that we're screening for at all of our well visits kind of in this age group. School concerns, 3rd grade is a common age where a lot of school problems come about. That's when kids really start with all their testing. School becomes a little bit more serious around that time. So this is a good age to kind of touch base with families and make sure that academically, are they doing okay? Sometimes we'll find maybe there's concern for dyslexia or a learning disability or ADHD, and then we can kind of get them hooked up with an appropriate evaluation for those things to make sure we're getting them any kind of care they might need for those issues. We're going to do scoliosis screenings at all of these visits. Anticipatory guidance in this age group, we're talking a lot about screen time, making sure that kids aren't spending too much time on their screens. We'll talk about bullying. We'll talk about nutrition, making sure they're making healthy food choices, getting regular exercise, bike helmets, sunscreen. So lots of things to talk about in this age group as well. Okay, adolescence. So this is probably one of the most important well visit age groups, I would say. This is kind of the age where we do see a lot of mental health disorders in kids, and sometimes they just don't feel comfortable talking to their parents about these issues. And they know that at 12 or 13, we start talking to them by themselves at each well visit. So hopefully, if there is a concern, they do feel comfortable talking to us about these issues. So we're going to give them an anxiety and a depression screening questionnaire at each well visit. We're going to address any problems with substance abuse. We're going to talk about any kind of high-risk sexual behaviors. We do find a lot of our adolescents are having sex, and trying to talk to them about, birth control, condoms, trying to at least help them be safe. girls, we tend to see a lot of menstrual disorders, whether it be just irregular cycles or really heavy cycles or polycystic ovaries. So this is something we're going to address at each of their well visits. This is a common age where I'll, maybe find out that a kid has an eating disorder. Again, just by looking at their growth curve, all of a sudden they came in and they went from being at the 50th percentile for years and years, and now they're at the 10th. So what's going on there? Making sure we address it. I'm going to talk about suicide with our adolescents, particularly with depression and anxiety. And this is a common age where we'll do sports physicals. So for all of our kids who are playing athletics, starting in middle school, they are required to have a sports physical each year. We can get that done when they're here at their well visits too. We're going to do cholesterol screenings, and again, talk about nutrition, exercise, making sure they're hanging out with kids that are making good choices. Safe driving. Car accidents is one of the number one causes of injury in this age group. So we're going to talk to them about safe driving. And if they have friends that aren't good drivers, make sure they don't get in the car with them. And again, we have this confidential discussion without the parent present during this part of the conversation. So hopefully they feel comfortable by the time they've been seeing us for a while to kind of talk about these things. Okay. And then young adulthood, it depends on your pediatric practice. My group tends to see kids like through college. So we tend to hang on to kids kind of through age 21. After that, we do say it's time to move on to the adult world. But I like seeing my kids 18 through 21. A lot of them end up going off to college, and I feel like it's a hard time to have them find a new provider just for those 3 years when they're not sure, where they're going to be living or what they're going to be doing after that time frame. So I typically do follow my patients like through 21. And at this age, we're doing a lot of transition into adulthood. So starting at 18, they are able to come in by themselves if they want to. Some do, some still come with their parent, I would say. And we're going to talk a lot about planning for their future. What is their goals? Are they going to go to college? Are they going to go to trade school? Are they going to get a job? Just making sure that they have some sort of plan for the future. We're going to talk about healthy relationships. A lot of these kids are in, relationships at this age, and making sure that they are in healthy relationships and what that looks like. Basically helping them to gain independence, take control of their health care. Again, a lot of them in college, if they're in Florida, we can still do Zoom telehealth sessions with them. So they are home frequently at Thanksgiving, Christmas, holidays. So a lot of these kids can still come in even though they're away at school. So just a couple more things I did want to hit on. One, your well visits are free. Your insurance does cover a routine well visit every year. So it doesn't cost you anything to make sure that your kids are coming in for their routine well visits. When we don't see them on a regular basis, it does make it harder when they're sick. If you know a kid's demeanor, how they normally act when they're healthy, it makes it much easier to help them when they're sick. So I do feel, very strongly about kids coming in for their well visits. And it just gives us the opportunity to, help take care of them and do a lot of preventative health and things that we don't have time to do at their, routine well visits. So I'm going to go ahead and open it up now to questions.
Thank you so much. That was some great information. I know my kids are now out of that age group, and our pediatrician held on to them until they were done with college. And I know that was great because anyone who comes to these talks knows that I am always drilling the point of it's all about the relationship that you have with your physician and creating that conversation back and forth. They're there to help guide you, the physician, but you need to know what you're looking for. And when you can create a nice relationship, it helps to move that forward. And if you start to teach your children that, it's going to help them down a better path. But one of the questions we have in the chat now is about seeing your child's records. And I know there's a certain age that it's cut off that you're not allowed to see their records anymore. And it goes to the other side of the spectrum too. I know seniors. So personally, for me, I have had my children, when they go to the doctors, to go ahead and allow me to see their records in case anything were to ever happen. I have that. I also did that with my older parents, that I can see their records. What is your guidance and what is the age on that?
Yes. So a lot of it has to do with our portal. And so parents can create a portal account for kids up to age 12. And between age 12 and 17, there is no portal access because their concern is that things like a child's social history might show up on the portal, and they feel like kids maybe wouldn't be as honest with us regarding things that they're worried that their parents might see. So parents can have a portal up to age 12. Between 12 and 17, it does go away. After 18, then the child can create their own portal account, and they can give their parent access to it if they choose to. They can sign, a document saying that they give their parents, rights to kind of view their healthcare records. It is tricky. We're trying to come up with something, because a plan where parents can at least just send us a message on the portal, even if they can't view records. So that's sort of what we're trying to work on at this point, because a lot of parents, it's frustrating. They don't want to have to call. They just want to send us a message. And without that portal access in that 12 to 17 age range, it is tricky. So we get a lot of complaints about that, I will be honest. But that is the law at this time currently, is that between 12 and 17, parents don't have access to that confidential information. Did that answer the question?
I think for the most part, yes, but I kind of adding on to that. At what age, like, can they call the office to ask something? Hey, do we have certain vaccines done? Not necessarily that I need to hear about the private conversations, but if I wanted to
Up
have
until 18. So parents can make medical decision making up until 18. And then at 18, if a child says, I don't want that vaccine, but the parent says, I want them to get it, they're 18, and we can't, we can't force them to get it at that point. But up to 18, the parent does have medical, decision making rights.
All right. Our next question is, during adolescence, when you are talking about sexual activity, do you talk about abstinence as being important, or do you just keep it very blank
No, we
and
always recommend that. Certainly I like to talk to all kids about
yay?
the risks, not just STDs, but also the seriousness that comes with a relationship, pregnancy. So we always absolutely, recommend that that's something that, they're thinking long and hard about. But the reality of it is, the studies show that treating doesn't usually work. And so most of our kids are pretty honest with us, and they, if they are doing that already, we want to make sure that they're at least having safe practices.
I liked what you were talking about with allergies. I don't think they really kind of pushed that when my kids were little about starting them to eat sooner, because there are so many allergies out there to foods that you're seeing. So the research from what you're seeing is now showing that if you get the kids eating earlier, that diminishes that.
Correct. Yes, actually, even between 4 and 6 months, introducing those highly allergenic foods like egg, peanut, fish. So it is recommended that by 6 months that they get exposure to those food proteins, and that has been shown to decrease, which is the risk of food allergies, which is a total shift from when I was a resident and we did training. 18 years ago, it was don't give babies peanut till 18 months, and so that was a big shift, I would say, in the last 10 years. But again, a lot of families don't know that. So that's something at that 4-month visit that we talk about, starting solids, and hey, it's important to do this, in the next few months, as far as reducing your baby's risk of food allergies. Now, there's exceptions to that. If there's a strong family history of food allergies, or a previous sibling, with a food allergy, we'll do some testing first.
Yeah, I have 2 kids who have nut allergies, and all tree nuts and peanuts, so, and a husband, so.
Yes,
But
it is stressful for sure.
it is. Anaphylactic is not fun. We also have some medication allergies. So that's one of the reasons you want to have that good relationship with your physician, so that you can have these conversations and see what's going on. I do not see any other questions in the chat. Does anyone have any other questions, or if you want to raise your hand? I'm going to turn off the recording right now.